St James's Hospital, inner city, Dublin. One of the country's biggest and busiest hospitals.
You did really well.
Big breath in, please.
Over 400,000 patients are treated here every year for a huge range of illnesses.
I was diagnosed with HIV. I thought I was going to die of AIDS.
Here, life and death are daily realities.
Oh God.
Pressure is pretty low.
You bring your A game.
Security to Alan's bay doors, please.
From the front line to the back office, hard decisions have to be made.
The hospital is full. There just physically isn't anywhere to put these patients.
And the pressure is always, always on.
It's a national emergency.
Six-year-old Trevor Plowman has been a patient at the Mercer's Institute for Successful Ageing in St James's Hospital for the last 6 months. He's keen to go home.
26th of September last year. And how I came to be here was that I had quite a serious stroke.
This is Trevor's scan. This is his brain scan, his MR scan. And you can see very clearly where the stroke is, just there. Now, the problem with Trevor is a lot of the nerve fibres that run from the part of the brain that controls movement runs through that part of the brain. So it's quite a small stroke. It's only a couple of centimetres in diameter. It's probably about 3 centimetres long. It's just in a very bad place.
What I want to do is to at least get myself on my feet so that I can actually walk again. Then I can go home.
I wouldn't want everybody to go home. I want everyone to get independent, but I have to use the experience I have and my knowledge of the subject to say, well, in this case, it's looking very difficult. We push the boat out a bit, we extend the stay, we look at rehabilitation techniques, we try different things. There's a certain point you reach where you go, well, it doesn't really look like he's going to make it over that next fence.
Hello.
Look who we have to see you today.
Hello, Ruby.
Come on.
How are you, my friend?
There you go. Say hello.
Hello. How are you?
We have a number of challenges with him. His house is beautiful, but it's structurally very difficult for somebody who'd be living in a wheelchair to manage him. The second thing is that tragically, Trevor's daughter died a few years ago, and Trevor has no other really close relatives who could provide him with one-to-one care.
I've got your lovely silky ear. Aren't I a lucky person? I have a love of dogs because of the 2 that we have at home, 2 little Jack Russells, which we inherited from our daughter, who's sadly no longer with us, but probably doing veterinary work for our supreme being. Anyway, she was a qualified physiotherapist, and she worked in the Mater Hospital, but that's as far as I can go. I can't talk about it much more. I've been getting intensive physiotherapy to try to bring back into circulation my left leg and my left arm. The left arm has been sort of left on the long finger because concentrating on walking has been most important. I was told that I would probably never leave a wheelchair. That's not me. I'm going to hopefully one day walk out of hospital.
George, can you hear me? Oh God, you're not feeling too great now, are you? Don't worry, we're going to call the doctors, okay?
Oh, I can't breathe and my chest hurts. Help! Go away.
20-year-old Bumi Oyatola is rushed to the emergency department. In severe pain, he is immediately administered morphine.
How long ago did you get the morphine?
35 minutes ago.
Oh, okay.
Bumi has a blood condition called sickle cell disease. His red blood cells are curved instead of flat, which causes blockages in his veins and arteries. When an attack happens, it's called a sickle cell crisis, which can cause serious organ damage or even death.
Once you get a crisis, it spreads really quickly, and the pain, 1 minute it could be like 2, the next minute it could be like 10. And the only thing that could make the pain better is morphine. It's like one of the strongest painkillers.
Bumi needs an emergency red cell exchange, which removes sickle cells and replaces them with healthy donor blood.
For me, it's just like same old, nothing new, really.
24 hours later, consultant Emma Toohey comes to check on Bumi.
Hi, Bumi.
Hey.
Now, how are you doing today?
You know, better than yesterday, so yeah, I'm good.
Okay, and the PCA then, they've stopped it completely?
Yeah, I'm going on the tablets now.
Okay,
yeah.
fine. And so any pain, how's your pain out on a scale of 1 to 10?
It's 5, it's just like gradually going down.
Okay, so I'm just going to have a quick listen to your chest, okay? Just going to get you to sit forward for me, and I'll listen through here, that's fine. Deep breath in and out. So sickle cell disease is an inherited condition. It is more common or more prevalent in those of African descent, but it's found in other parts of the world, such as the Middle East and in South America. One of the main complications is that of a painful crisis. Now, some of my female patients have told me that the pain is actually worse than childbirth.
This illness can be life-threatening, and I'm still alive. After all the amount of attacks I've had, there's even some times where I even forget that I have this illness that will just be, you know, going on as a normal teenage boy, that's what teenage boys do in their life around this time, basically. So it's just trying not to make it a big deal, pretty much, is what I do.
The first time I met this guy was in Crumlin Hospital, and we had a blood transfusion together. Yeah. And I was just doing my own thing on my phone. Yeah. And this guy comes to me and says, "Yo, nice shoes, bro." Oh man, that's mad, bro. That's mad.
Just like to say to everybody, thanks. We've had so much good fun, and we had busy times, but yeah, no matter how busy it was, we had time for each other. And thanks again.
I'll say one last time. That's not my job.
That's not my job. Look at that. Never go home to her job.
Some 93% of surgeons in Ireland are male. Sarah Early is one of the very few female cardiac surgeons. Today, she's seeing patient Patricia Ryan, who has a faulty valve in her aorta.
What happens when you get on a hill?
I just breathing and, you know,
okay.
Really, you know, trying to get my breath.
Okay.
And it's hard.
Looking back now, how long would you say this is going on?
Definitely looking 6-7 years.
Okay. Okay. But getting significantly worse though?
Yeah. I'm getting ready for tomorrow, so hopefully. Just wanted to come and get it over and done with. You prefer not to be here, but sure. If I get what I get done, then I'll be going home, so that'll be fine, you know. Smoking? Oh, my 45, 46 years professionally. Near enough.
All right then, I'll see you tomorrow. Okay, thanks. Bye. I'm 35 weeks pregnant. So clearly there are time pressures with regard to the number of cases that I can perform. The most important thing is that I can perform these cases safely and I feel comfortable operating. Any last-minute questions or anything?
No, you're grand now.
There aren't really in the world that many female cardiac surgeons, and in Ireland there aren't that many female surgeons. Certainly I have had a number of patients quite surprised, when they see me and have asked, well, but when is the actual surgeon coming? Sometimes I do feel it might be slightly easier if I was maybe 5 kilos heavier with a beard and grey hair. Definitely. I wouldn't get asked as many questions. One man actually said to me, he goes, I'd much rather have a woman, because like, if you're a woman doing this job, like, you must be really good. And I was like, correct. This bit here, we're going to open all this. So this is just a little bit of fat that sits on top. So you can see moving underneath here is the heart, see that? So we're just going to open up the little sac that the heart sits in. And as we open all of this stuff, we're coming down onto the aorta, which is the main blood vessel out of the heart. So you can see there's her aorta, and there's her heart.
To repair Patricia's aorta, Sarah has to temporarily stop the heart. Patricia is put on a bypass machine, which takes over the function of her heart and lungs during the operation.
Okay, coming on bypass.
You're stopping there, I think.
Okay, yes,
Nice.
you've got stasis.
How much have you in?
That is 450.
Okay. Knife, please. So we make a hole in the aorta now. And right up on your blue.
Right up on blue.
Good God. Wow.
Patricia's aorta is worse than expected.
So that is a very, very, very abnormal aortic valve. It's very, very calcified and very abnormal. Sorry, I'm actually crushing it so hard. So hopefully it doesn't detach when I take it away.
If the calcium detaches, there is a high risk it could travel to Patricia's brain, where it could cause a life-threatening stroke.
Janie Mac, how is this woman getting around? It's terrible, isn't it? Okay.
Cardiac surgeon Sarah Early is seeking to repair Patricia Ryan's damaged aorta. She's discovered extensive calcium deposits on the valve. If the calcium isn't removed carefully, there's a risk it could travel to Patricia's brain and cause a stroke.
There's all that calcium that I was talking right down into the mitral. Oh, God. Okay, if I can take off a bit more stuff. Okay, can I get the sizers again, thanks? I think if this comes away, we'll be in good shape. Next, thanks.
The calcium deposits are successfully removed and a mechanical valve is sewn into the aorta. Patricia is now ready to come off bypass, which will test the success of the repair.
Can we get ready to fill the heart and blow on the lungs?
Okay, ready to fill?
Okay, fill away.
Filling now.
And keep filling, 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 filling.
Quarter. Off bypass.
Okay, your line is good here.
Thank you.
Okay, right. Clamp is off, right up on the blue.
Right up on blue.
Right up on blue. Good. I'm not really sure what rhythm that is at the moment. It's pretty wide to say.
Patricia's heart has entered a dangerous, irregular rhythm, suggesting something is wrong.
There. Down on flow for a sec.
Down on flow.
Okay. Back up.
Back up.
Okay. Okay, perfect. Brilliant.
After applying a small electric shock to Patricia's heart, it finally returns to a normal rhythm.
Hang on, it's better at this side, is it?
American-born Bob Bevans has cancer of the mouth. Tomorrow, he will undergo one of the most complex surgeries provided by St. James's Hospital. Part of his mouth and jaw will be removed and then rebuilt using bone from his leg. Bob's speech and swallow could be altered permanently.
I had this little place in my mouth like an ulcer, and I went to the doctor and he looked at it and he said, God, I don't know. I don't even know what I'm looking at. So I went to my local dentist, and as soon as he seen it, he said, "Oh boy," he said, no, this is no good. So he sent me further afield then.
Why don't we just sit in here in one of the rooms? Yeah.
Bob and his daughter are attending a last consultation with his 2 surgeons the day before the operation. Paul Lennon will remove the tumour.
We'll be going through the lip here. You'll have a scar going straight down, and then down along the neck, and then over to the side. We'll start off by clearing out the neck of any lymph nodes. There's no sign that the cancer has spread to the lymph nodes, but we still clear it out just in case. Then we'll move on and actually take out the tumour itself in the bit in the bottom of the mouth, so what we call the floor of the mouth. And the jawbone itself, we've been taking out obviously the chunk of the jawbone. Do you guys have any questions for me?
Well, no.
You stop smoking now?
Well, to tell you the truth, I've been smoking an odd one.
Even the healing is better when you're not smoking, if you know what I mean. And afterwards, certainly when you're going through the radiation, the smoking is like the one thing that you can do that we have no power over, if you know what I mean. That like you've got the power over. Like.
I just show you without the clone. You can see that we still have this amount, but as you know how far we are more or less from this tooth.
Surgeon Conor Barry will conduct the second part of the surgery, reconstructing Bob's jaw using bone from his leg.
We have a special scanning protocol for these patients, and based on the CT scans we get, the raw data from the scans is uploaded to a website, and this company is based in Belgium. We then have this planning session, and they use the data that I've uploaded to digitally reconstruct both the jaws, but also where I'm going to take the graft from.
I'll just show you what the tumor is.
Yeah. My plan is to use the left fibula to reconstruct this segment. He's actually got a very V-shaped mandible.
Yeah.
Normally you try and restore it exactly, but sometimes perfection is the enemy of good. I think I'm happy with that, Martin. Are you happy?
Yeah.
We could touch the stars way up in the blues if you only say, darling, I love you. Heaven waits for those who dare to climb what? The stairway of love. The stairway of love.
Not just a pretty face.
It's 3 weeks since 20-year-old Bumi Oyetola had his sickle cell crisis. Today, he's back in hospital for another red cell exchange to remove his sickle cells and replace them with healthy donor blood. Bumi will need an exchange every month in order to prevent further crises.
Yeah, I remember this disgusting medicine.
In the blood bank here is where we keep our ongoing patient. One of those is Mr. Oyetola, is one of our sickle cell ongoing patient, and he needs, when he gets transfusion, he needs 10 red cell less than 10 days old with a particular, they're like a rare kind of red cell.
Bumi has a rare blood type. The blood he hopes to receive today is particularly precious because there are so few donors. Once out of the fridge, it needs to be used within a short time frame.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We've received the blood in from the IBTS earlier on today, so I'm just going to get it out of the fridge now and reserve it for him in our lab system. They have 4 hours to use it, and if not, it's wasted basically, so that's why it's so strict. Hi, I'm ringing from Blood Transfusion. I have some blood to go to Dennis Burger fridge, please.
Today, clinical nurse specialist Edel Crampton is hoping to get 10 bags of blood into Bumi. As the blood can only be at room temperature for a limited amount of time, she has to bring it up in batches.
Are you taking out or putting? Please remove the blood unit.
If it's out too long or the veins are bad, the blood gets wasted, as I said, after 4 hours. So because the distance of the fridge, we can only bring it in small volumes. Feeling okay, Boomy?
Yeah.
Good stuff. Veins are going to be fabulous, aren't they? So we have 4 hours to get these 5 units in, if we can. And there's another 5 waiting for you. This is where we wait with suspense. Move your fingers in and out. No, the vein's gone completely flat.
Has it?
Yeah. So this is what we don't want to happen. We don't want to hear these beeps. Just going to maneuver your arm just to take the pressure. If you even keep it like that until we get up and running, see, it doesn't make it any better. Just straighten your arm a bit there for me.
If this blood exchange fails, Boomy will be more susceptible to an attack, which can be triggered by dehydration, infection, or even cold weather. The blood will also be wasted.
Now just loosen that for a second, Boomy, because it looks like the dressing might be pulling it to one side. Just feel it. It's gone completely flat again. But some people, we don't know why, once they go in the machine,
It just flops.
yeah. See the way all your veins are going flat, it's like they go into spasm. It's going a bit better now. Come on! It's doing more now than it was. Keep going if we can get it up and running. No. If we don't get this done, this blood will be wasted. So that's where we all get very disappointed. But there's only so many times we can keep trying as well. So.
I just need to make sure we don't put 2 people into the one bed. Because that is not allowed, okay?
Bob Bevans is facing a highly complex 10-hour operation to remove a tumour from his mouth. This will require a large section of his jaw to be removed before reconstruction using bone from his leg.
Jesus, that's not going to be pretty. I'll wake up probably about 12 o'clock to that, even if I'm lucky. Yeah, it's good. It's an all-day thing, I believe. So just wait and see.
Ah. Good morning.
How are you doing?
How are you? Good.
Yeah, the waiting's the worst thing.
Okay.
Okay.
You just relax there for the moment.
See you then.
Yeah.
Thanks.
Good stuff. Hopefully we'll have some good news soon.
I do too.
My part of the surgery is pretty straightforward, that I just have to take the cancer out. The cancer might be a little bit bigger, or the cancer might be a little bit worse than we think on the scans or by looking at it. So we might have to take a little bit more. You know, not everything works out every time, so hopefully it will all go to plan and hopefully it'll be run very smoothly.
You know, as I said to Bob, you always have to have a plan B in surgery and possibly a plan C as well, because there's so many uncontrollables in surgery.
As head and neck surgeon, Paul Lennon starts operating on Bob's throat. Conor Barry starts the difficult job of removing bone from Bob's leg for the reconstruction. It's critical that the bone has a strong blood supply.
The bone is out. Blood supply has been dissected. That's the little blood vessel going to the skin.
Surgeon Paul Lennon isolates the tumour, ready to begin the job of removing it.
So we've taken a good bit of tissue around it as well, because it's eating into the bone in this way. Straight down. So.
Cancers are often more sneaky than you think. So to get clear margins, we take a good 1 centimetre. You can already see around there, there's a centimetre of what we call normal mucosa, normal tissue around it. And that hopefully is enough. That means that, yes, if it's eaten into the bone, he'll probably need radiation as well, but it might save him from getting chemoradiation if we don't have what we call positive margins.
With the tumour removed, surgeon Conor Barry begins the difficult and complex part of the operation to reconstruct Bob's face and jaw. This procedure will determine how much speech and swallow function Bob will have in the future. Bob Bevans has been in surgery for 7 hours now. The tumour in his mouth has been removed and a bone graft from his leg has been put in place to reconstruct his jaw. The next stage requires intricate and painstaking microsurgery.
We always kind of think when the microscope comes in, we're in the home straight, but in reality, really we've got a fair bit of surgery left to go.
Surgeon Conor Barry needs to carefully stitch the vessels attached to Bob's implanted leg bone to the veins and arteries in his jaw. The team also take a skin graft from Bob's leg to replace the skin on the inside of his mouth.
We need to know that there's arterial blood going to all the tissue and being drained out. If there's no blood going to it, it'll be really white, which is what worried me. There probably wasn't a huge amount of blood going to that skin, even before we attacked him with knives. Long day, yeah. At least it's only once a week.
Bob has come through the operation. He now faces an anxious wait to see if his swallow and speech have been maintained.
You're okay. Can you give my hand a big squeeze?
Okay, we need to stop compressions.
Okay.
Stop compressions.
Oh, sorry. Yeah, and you have to actually,
Okay.
once I literally had to, sorry for this, reach over and just grab his right arm there, will you? Literally had to do that.
Trevor Plowman has been in St James's Hospital for 6 months now, after suffering a stroke which left him in a wheelchair. Trevor hoped to return home, but has accepted that's no longer an option.
We've agreed that he's probably going to need, certainly in the short to medium term, some level of care, and he's asked to be referred to Leopardstown Park Hospital. Hiya, Trevor. How are you
Hello,
today?
Professor. I'm very well indeed, thank you.
And how's the arm?
It's coming along.
A few days ago, Trevor was moved to the Kilmainham ward, a holding ward for patients awaiting discharge. His physiotherapy has stopped, though he is still determined to walk again.
I was disappointed at the rule that physio couldn't be continued on for me up here, but then I understand that if they made an exception for one, then the whole ward...
It's a matter of just resources. I mean, it's just a matter of resources. It's just...
Yes, I understand that. Place the unaffected leg under the affected leg. Fortunately, I had made enough of an impression on the two physios. They came up with 2 sheets of paper, illustrated, with instructions of how to keep myself fit in the wheelchair. Use the unaffected leg to assist the affected leg up to a straight knee position. Do 1 set 2 times a day. We are human beings, even though we're patients, and we have our own determination to do our own things. And that's what I'm going to do.
Control to all units there. We have a missing patient, age 51. He's wearing blue jeans and a navy striped jumper.
Now.
Cardiac surgeon Sarah Early makes her final rounds before going home. She comes to see Patricia Ryan, whose aorta was severely damaged.
Everything went really well yesterday. We took out the old valve, put in a new valve, put the mechanical valve in, and everything was absolutely fine. Good. Your heart is in really good shape. It's very, very, very strong. But I'm not sure how you were getting around for as long as you were with the valve that you had, because it was very bad. And the other good thing is your heart rate is back to normal, so there's no problems with that, so no need for a pacemaker or anything like that. Great. So it's good. Great. It's all good news.
Thank you.
Any questions? No?
Sarah is 36 weeks pregnant and will soon go on maternity leave.
I am pretty heavily pregnant now, and I was concerned about how I would be able to operate and how long I would be able to operate for. So I've been very lucky that I've been able to operate the whole way through. I mean, patients get a little uneasy and they look at me, but you know, it's pregnancy, it's not a disease. You know, I'm still able to function as a human, I'm still able to do my job, so yeah, it's been okay, it's been good. I think my one major concern is, you know, on call, I can't really bring the baby in with me, so that is going to be a problem. But we'll figure that out. I don't know how I'm going to figure it out. We'll figure it out.
You do a lap of the corridor.
Oh, here we go,
We'll go up here.
Now, one thing we're not doing is holding hands, right? This is a hospital, not a comedy show.
Come on, we'll do the whole way, will we?
Hello.
How are you?
You're looking well today.
Plum waltzing.
Ah, yeah. Or licking their arse, as they call them, playing words.
It's 2 weeks since stroke patient Trevor Plowman was moved to a holding ward. He's still waiting for a place to come free in his chosen nursing home. He remains hopeful that he'll walk again.
I've been verbally told that I'm accepted and on a priority list. And they have something extra to what physios here have, and that's hydrotherapy. So I'm very interested in that and hoping that that will help my left leg back to full use. Trevor is my name.
In the meantime, Trevor attends the Mercer's Institute for Successful Ageing choir group in the hospital's creative life space.
You're in the patient, are you long?
Since last September.
Oh, no. You're only trying to
Stroke.
Can you walk? Can you?
Not yet. I've got strength in the right side, fortunately.
Yeah.
But
the left leg, is it?
the left leg and left arm.
Was your speech affected at the start?
No. Thank goodness.
Right, so let's do a quick warm-up. Everybody who can stand, stand.
Yeah, okay.
Okay, your own pitch. Are we ready? And ooh.
Hopefully I'll be invoiced today. The choir I used to be in was the Jubilate choir, and that's based in the very big church in Temple Oak. And I loved it. I was sang in the bass section there. I must say it gave me a great boost. You know, it has a great feel-good factor, and I really enjoyed the effect of music upon me.
Very nice. How does that feel? Good.
Bumi Oyetola has sickle cell disease and suffers frequent, hugely painful attacks. Staff are trying to exchange healthy blood for his sickle cell blood. However, because of frequent hospital admissions, Bumi's veins are prone to collapse.
So we have a bigger needle. It's
bigger needle?
Yeah, and it's metal and it stays in the arm.
Mm-hmm.
But it's good.
Okay.
If we can get a vein big enough to hold it. But these look, it'll be kind of your last try. What do you think?
Okay, let's try this one.
Now. You want to close your eyes?
Mm-hmm.
Think happy thoughts?
Thinking happy thoughts.
Nothing.
history. Gone completely flat again. To try and avoid wasting all the units, we can transfuse some of them. So at least his levels will still come down. Hopefully we'll get some blood and some good out of today.
Clinical nurse specialists Noel Nowell and Adele Crampton were hoping to exchange 10 units of blood today. 5 units have been taken from the fridge, 2 units were transfused, which means 3 units of blood will need to be discarded.
We're literally trying since 3 o'clock to get it up and running. So there'll be actually 3 wasted.
This is the biggest amount of blood that's gone to waste, which is really sad, you know, all the time and effort spent getting the blood and then getting it here and stuff like that.
Thanks a million. Bye, bye-bye.
It didn't take so much of my time, to be honest, but at the same time, you know, I'd much rather be in college than here, but I obviously have to be here for reasons. But yeah, that's pretty much it.
As the blood exchange procedure failed, Boomy had a more simple blood transfusion. He will return to the hospital every 3 weeks for further transfusions.
With the snow much. Oh, it's lovely, isn't it? Oh!
Just gonna have a look here. Say all for me.
All for you.
3 weeks ago, Bob Bevans had a complex 10-hour surgery to remove a tumour from the floor of his mouth. Surgeon Conor Barry reconstructed his lower jaw with bone from his leg.
So this is the leg bone, or the fibula bone, that we've transferred from the leg up to the jaw. It's a fairly short section of bone. I wanted to position it a little bit above the lower border so that we can, at a later stage, put in some dental implants and give him some more teeth. Bob's lost the nerve on this side. The patients cope very well. They adapt very well to having numbness on one side of their lip and chin, but not both. The morbidity is greatly increased. So that's why we've bent the plate downwards and following the contour of the jaw towards the lower border to avoid that nerve.
The operation to remove the tumour and rebuild the jawbone has been a success. However, Bob's speech and swallow function also need to be assessed. Surgeon Conor Barry is joined by surgeon Paul Lennon.
I'm just going to have a look in your mouth and check the, and that's is the skin from your free flap. And when we first put that in, Bob, it was the same colour as it was pale white, pasty white, like the skin of your legs from the Irish winter. But now it's a lovely pink. It's taken on the same kind of hue as the other tissues in the mouth, so I'm really pleased with that. It's sealed up the mouth from the neck. It's maintained the mobility of the tongue. Stick your tongue out, Bob. So Bob has excellent tongue mobility over to here and over to here. And you can tell that anyway by the fact that he has really good speech and swallow. In fact, I think in a few weeks or a couple of months, nobody will even know you've had surgery.
I doubt it. I'd be very surprised.
Yeah. Good stuff.
Oh, no, I'm very quite happy with both of the work both gentlemen done.
No, you've done very well.
Yeah, you've healed up really, really well.
You're brilliant, the two of you, I must say. I give you full marks.
Thank you very much, Bob. We're probably got you cured, but we'll take every percentage that we can get. So I think, the best thing will be to give you radiation as well.
Important to stay strong now for the next part of the treatment.
Exactly, yes.
Okay.
Yeah, for sure.
Good stuff.
I'd like to thank you both of you.
Not at all.
Not at all.
Thanks to you too.
No problem.
Sure we'll meet again.
We will. We'll be looking after you for a long, long time.
Yeah. You'll be coming back to our clinic. You'll be sick of the sight of us.
The daughter's going to pick me up and she's going to whisk me back down to Tipperary. We'll get back down in God's country then. Yeah, that's the well-wishers that said that I'd never make it back. That I was 10 to 1 that I wouldn't make it. Yeah, I fooled them all. I even put a tinder on myself. I doubt if I'll go back on the cigarettes, to tell you the truth. And I've smoked over 50 years. Nobody can smoke cigarettes over 50 years and not do something, you know. Never even pick up the first cigarette and light it, because you're doomed. If you light the first one, you're going to light the second one. And then 50 years down the road, you won't be lighting them. They'll be lighting you up down the crematorium. That's what will be lighting next.
So our guy is on the campus.
What's he wearing?
James is great top. He's fighting with them.
Yeah.
There. Every one of them walks past the camera. Every one of them will be identifiable.
Yeah.
Right, there's your money shot then.
Grand, well, I'll download that anyway for the guards.
We have him for the assault, we have him for the threats, we have pictures of him. It's up to the guards to pursue this now, right? But we're just giving them as much as we can.
Stroke patient Trevor Plowman has been in St James's for 7 months now. Today, he leaves for a nursing home in County Dublin.
Best of luck, Trevor. It was a pleasure to meet you.
You're very nice.
Absolute pleasure.
Thank you, and I hope you're very happy together.
Good luck, Trevor.
In every aspect of life.
And you too.
Very best of luck, Trevor.
Remember one word for both of us. Determination.
Determination.
That's it.
That's it. You're right, Trevor.
Yeah.
Thanks.
Cheerio. A smooth departure.
I forgot my L plates.
Just going in to say goodbye. I hope I'm not going to disturb anyone. Just push me in forward. Just going. I want to say goodbye to all of you. I'm off to Leopardstown Park Hospital. Transferring. So we'll be. I won't be coming to you anymore. Sadly, because I've enjoyed my time.
Yeah.
Thank you so much.
Lovely having you. Listen, it's been so lovely having you.
Not at all. It's
And
been
thanks very much for all the singing. You're terrific.
Oh, thank you. Thank you very much. That was totally undeserved.
No, on the contrary.
Thank you very much indeed. Love to come. Very positive journey. It means that I am progressing from one stage of recovery to the next, and I'm looking forward to it very much.